Hey, Jeff Nelson with VegSource. Thanks for tuning in. Today, I have a really amazing human being with me, Dr. Alan Goldhamer, who is probably the foremost expert in the world on the use of medically supervised water-only fasting. Welcome, Dr. Goldhamer.
Good to be here.
Great to have you. I've known Dr. Goldhamer for over 20 years, and he is the director of True North Health Center, where since 1984, he supervised the fasting and care of over 25,000 people. That is a lot of experience over the past 40 years. And True North Health is in Santa Rosa, California, Northern California. It's a multidisciplinary practice that includes medical doctors, osteopaths, chiropractors, naturopaths, and psychologists. People go to True North to treat and reverse a whole host of problems like high blood pressure, diabetes, autoimmune disorders, even things like lymphoma. And this, I was just there myself this past December. I made a video about it. You can watch on my channel and the success that I had. It's the largest facility in the world, really, that specializes in medically supervised water-only fasting. And it's the top training facility for doctors to get certification in the supervision of therapeutic fasting. Dr. Goldhamer has written a number of books, including the very well-known bestseller, The Pleasure Trap, Mastering the Hidden Force That Undermines Health and Happiness. You've probably heard of that. If not, you should know about it. He's helped author numerous studies and case reports published in peer-reviewed journals. And we've had him speak many times at our events over the years, and he's always a big favorite. And he's got a brand new book out. It's right here. It's called Can Fasting Save Your Life? The answer is yes, but it's out next week, or depending on when you're watching this video, it's probably already out. I'm going to put a link in the description below where you can go check it out. This is an amazing book. It's really great. I have read it, and I'm going to read actually a couple of comments from some people who've also read it. Here's one from Dr. Michael Clapper. He says, Can Fasting Save Your Life is the best fasting book available, offering clinical insights and a clarion call to the research community to study this neglected lifestyle intervention. Here's one more from John McDougall. Dr. McDougall, he says, the best and last hope I've been able to offer my patients over the past 40 years is a water fast under the direction of Dr. Alan Goldhamer. Water is the ultimate no-fat, low-cholesterol treatment that every person should try before declaring defeat. So there's a lot of high praise from many top medical doctors here you're going to find. Alan, how did you end up over 40 years ago deciding to go into the water-only fasting, for a living?
Yeah, when I was a kid, I actually was a little bit frustrated. I was a basketball player, and I used to play with Dr. Lyle, and he would just beat me mercilessly. And I really wanted to beat him. And I practiced, but he was just so much better. So I thought, well, maybe I could get an edge. And I thought if I got healthier than he was, maybe that would give me leverage. And I started reading some books, and I came across a book by Herbert Shelton. And he said that health had causes. Just like diseases have cause, health had causes. And the cause of health was healthful living. It was diet, sleep, exercise. And if you did the right things with diet, sleep, and exercise, you'd get healthier. And I thought, okay, that'll give me the edge that I need. And of course, it failed miserably because he adopted the same diet I did. Here I am, 65 years old. He's still kicking my butt every time we play. So it didn't help me beat him in basketball, but it did get me very interested. And, kids that are on the spectrum, some of them get interested in dinosaurs, some of them get interested in spiders. I happen to get interested in this idea of diet and fasting. And so that's really all I've done for the last, 59 years is just get involved with this type of this kind of process. And so it's that's how it all kind of got started.
Wow. I mean, in the Pleasure Trap book, you and Doug pretty well deconstruct and explain why so many of us are overweight, it's the food that we're eating and how we're not. Can you talk about that and a little bit?
Well, yeah, it's really interesting today because being overweight is sometimes seen as like an aesthetic problem, or it's socially inappropriate to even acknowledge that being overweight might be a health issue. But in fact, being overweight is not just an aesthetic concern, it's a major health risk factor. In fact, recently with the COVID epidemic, one of the leading risk factors on determining whether you die or recover was how fat were you? How much visceral fat in particular do you have on your body? The problem with fat is about 10% of our total fat is something called visceral fat, which is the fat that tends to accumulate around the belly and the organs. And that fat is hypertrophic and hypermetabolic. It acts like a tumor. And it produces inflammatory products that contribute to heart disease, cancer, diabetes, autoimmune diseases. These are the leading causes of death and disability in our society. And what's interesting about these different diseases, they're treated like they're completely independent diseases. You have to go to different doctors even to be diagnosed and treated with them, and yet they all have a common cause, which is excess fat, and particularly excess visceral fat. And so getting rid of the visceral fat, I mean, it's like if you went up to a person and said, look, you have a 2-pound abdominal tumor. They wouldn't be shocked to find out that having a 2-pound abdominal tumor would, not a good thing for their health. And that's essentially, if you're 20 pounds overweight and 10% of your fat is visceral fat, you essentially have a 2-pound tumor producing inflammatory products contributing to your death and disability. So getting rid of that is a good idea. And fortunately, it turns out that you can lose fat and visceral fat with diet, with exercise. These things work very well. If you want to make it happen quicker and you want to preferentially mobilize your visceral fat, one of the options would be water-only fasting. Because water fasting, as we've demonstrated in a study recently using a DEXA scanner to look at what happens to body composition, preferentially mobilizes visceral fat. So let's say, for example, an individual went on a 2-week fast. They may lose an average of about 10% of their total body weight, but they'd likely lose 20% of their total fat and 40 to 50% of their visceral fat. And then when they come off the fast and they're regaining weight, the weight they're regaining then is water, glycogen, fiber, and protein, not fat. On a whole plant food SOS-free diet, that weight is going to come up, but the fat is going to continue to come down. So you can use fasting to apportion your body composition, getting rid of the fat and visceral fat, reducing your risk factors from these common diseases of dietary excess. And that's probably why we see such consistent results in treating hypertension and diabetes, autoimmune diseases, and some forms of cancer, including lymphoma.
Yeah, well, I mean, it happened for me just 6 or 7 months ago. I was up there in December before Christmas, and I went in. I did, as you know, a 2-week, well, was it a 10-day fast, I guess? And yeah,
Okay.
and so it was a 10-day fast, and I lost 15 pounds, of which 10 pounds I have kept off since then, and brought my blood pressure, which I think the first night I was there was 140 over 80, low 80s or something like that, where I didn't want it to be. And I got a blood pressure cuff. Now I take it every morning just to make sure. And I'm still, at the 106 over 72
Right.
or something, 6 or 7 months out. And yes, I changed my diet as a result. But so it's sort of, I think the whole food plant-based diet helps to slowly eliminate fat, but going up and doing something like this, wow, it just, it lifts your spirit too. It makes you feel like, no, I don't have to take a drug or, whatever, or work extra hard. The fast just kind of does it automatically. Talk about, and the fact, as you say that
it was interesting though, not only did, you were already a vegetarian and healthier than almost everybody, but that little fine-tuning compounded with fasting clearly made a significant clinical difference. More importantly, though, you looked at a specific biomarker in your stay, lipoprotein(a), which
Right.
generally people don't get too excited about because they believe that you can't change it. In other words, insurance will only pay for one test because once you determine whether you're at risk or not, there's no drug or pill or potion that's been shown to be effective at reducing that risk factor. So they let you identify it, recognize you're at increased risk, but then there's nothing that can be done. And
Yes.
yet you insisted on retesting that and kind of brought something very interesting to light. In fact, your case is a study that we wrote up and has been accepted for publication.
Oh, really? Oh,
In
great.
the scientific literature because, in fact, it dropped 40%.
Yeah, I know. Diet's not supposed to make any difference. There's nothing you can do. Well, actually,
And
That's
now we're actually looking at that marker in a number of people because we're actually it's inspired us to go ahead and do a clinical trial because I also believed, well, we weren't routinely monitoring it because I was told it doesn't change. It's genetic. There's nothing you can do. Learn to live with it. And so now we're thinking, well, maybe it's not quite that simple.
No. I mean, that was actually Jeff Novick is the guy who suggested that I have that test before I went into the fast. So I said, oh, okay, sure. And I found out, and I was, disappointed to see that my number was high. And especially, as I say, knowing that there's nothing you can do about it. And then what a delight to see such a dramatic lowering in just a matter of, a short time. I waited on your advice 6 weeks before you're doing the retest because I guess your body's kind of settling right after the fast just to see long term and that's when I saw that it had come down so much.
Yeah,
so why is it so hard?
Point that there's a lot of changes that occur in fasting, but not all of them occur like just during fasting. Many of the improvements continue in the days and weeks after fasting. So to get an accurate picture, you want to wait a few weeks till your body has switched back to normal metabolism. And so that there's a biochemical switch that occurs when your body goes into fasting. You have to change your fuel from burning glucose, which is the normal fuel, to burning beta hydroxybutyric acid, particularly in the brain. And that's what allows humans to be able to fast for long periods of time. If you couldn't fast, you would only go about a week or so before you'd enter starvation mode, break down your vital proteins, and die. Because human beings can fast and change to burning fat, the average 70-kilogram male could fast up to 70 days. Not that they should fast for 70 days, but you could fast for 70 days. This was such an important part of human being survival that all the humans that didn't have the ability to make that switch died. It's a biological adaptation. All human beings, if you withdraw food, they go into ketosis as their body shifts from burning glucose to burning fat. This was because, think about it, in the world of our ancient ancestors, if you wandered away from the tropics, the first time spring came late, you died. Because the brain, our biggest burner of glucose, is just such an energy hog. And so it also was helpful because it allowed us to survive and dominate the planet and all that kind of stuff. But because of that vulnerability, either you would stay in an area where there's a reliable source of calories all year long, or you perish. So today we know that it was critical because it's true with every person in every culture, other than the very rare person with a biochemical defect, everybody can fast.
Interesting. Survival of the fittest. So the people who can fast, that's who made it into modern day. I've always thought that, hey, eat plant-based or as much as you can. That's really helpful. More recently, as I'm 68 years old, I'm also thinking, get lean. That's important for, your health span, for not just trying to live longer, but be healthy as long as possible while you're still here. And it seems like just, sort of simple calories figure into the equation here, and fasting is a way to supercharge. Why is it so hard for people to escape the dietary pleasure trap?
Yeah, that's a really, really important point. For example, alcohol. People realize some people that drink alcohol become alcoholics, okay? And people that are alcoholics, their life eventually sucks, usually pretty badly. But it's very difficult to quit drinking. Like, for example, if you go to an inpatient facility and spend $40,000 for 30 days, and then you go to 90 visits in 90 days to a 12-step program, and you have family support, somewhere between 80 and 90% of people will fail to quit drinking even for 1 year. Wow. If you're a heroin addict and you go to inpatient care, even if it's court mandated, the chance of being successful at quitting heroin for 1 year, 10%, 90% failure rate. But if you're overweight and you want to lose just 5% of your body weight and keep it off for 1 year, the chance of that happening using any conventional medical weight loss approach is 5%. There's a 95% failure rate. In other words, you have a better chance of beating heroin than losing weight and keeping it off.
Oh my God.
Here's why. With alcoholics and drug addicts, we tell them the truth. We say, look, you have a vulnerability to this particular chemical that artificially stimulates dopamine in your brain, and you need to not drink. We don't say, oh, you just drink beer and wine and you'll be fine, or put your alcohol in a smaller cup, or, drink your alcohol with a spoon and you won't be a drunk anymore. We tell them the truth. You have to quit. And, do people want to hear that? No. they would rather hear, well, just drink after 5 p.m. or don't, drink on the weekends. But we know that's not true. We know that the failure rate, for example, with alcoholics that keep drinking is 99.9%, okay? Now, with overweight people, we lie to them. We tell them, well, all you have to do is eat less or put your food on a smaller plate. Chop your food up into small bits and then put your fork down, and then you won't be overweight anymore. And so what happens is they have a huge failure rate because they're not being told the truth. And the truth is that they're sensitive to specific chemicals that have been put into the feed that artificially stimulate dopamine in the brain, just like drugs do. And as a consequence, they're an addict and they have to not take those chemicals. Now, people say, well, wait, can some people have a drink and not become a drunk? Sure. But if you're a drunk, it's not you. Can some people eat a little bit of cheese or chocolate or whatever it is and not become overweight? Yes. But if you're overweight, and 72% of the population is, it's not you. If you could have controlled it, you would have controlled it. You tried. You did your best. Now you have to accept the fact that those chemicals create a situation for you. You need to avoid the things that cause it. And then we wouldn't have a 95% failure rate. And in fact, our experience is that a significant percentage of people can lose weight and keep it off, but they have to do dangerous and radical things like eat well and exercise and go to bed on time. And those things are considered, inappropriate and too difficult and not possible. But for those people willing to do that, they can have a much higher success rate. But it's a hugely difficult problem. I want you to think about something else. If your BMI is 40 or more, so you have significant obesity, the chance of you ever losing that weight and keeping it off is, for a male, 1 in 1,287. For a female, it's about 1 in 660, a 99.99% failure rate.
Wow.
And physicians know that. And that's why they don't really want to spend their time talking to patients about weight loss, because they know nobody ever loses weight and keeps it off, at least not being lied to and told, well, just eat less. Or they'll say, maybe if you cut the animal food down, change the color of your meat from red to white, that'll solve the problem. Or don't have oil, but you can have sugar and salt. Or don't have sugar, but you can have oil and salt. Or don't have sugar and oil, but you can have salt. And the reality is that doesn't work. And people get upset about that. They want to really defend the chemicals that are added to food that stimulate dopamine in the brain. Those chemicals are salt, oil, and sugar. That's why we talk about a vegan diet needs to also be SOS free. SOS is the international symbol of danger, but it stands for the chemicals added to food that make us fat, sick, and miserable. And that's salt, oil, and sugar. And we get a lot of criticism for that, because particularly when we start talking about salt, because they say, well, wait a second. Okay, I understand sugar, refined carbohydrates. Okay, we'll give up the sugar. But oil, what about olive oil, right? So the problem with something that's, say, less bad, like olive oil, doesn't mean it's good. It's just less bad. And being less bad isn't the same thing as being good. Oil is a highly processed fractionated food. It has 9 calories per gram. Even olive oil is not a health-promoting food. And when it comes to weight loss, it'll fool the satiety mechanisms. Like Dr. McDougall says, the fat you eat is the fat you wear. Even more criticism do we get when we start talking about salt, because salt's an essential critical nutrient without which you die. But you get all the sodium you need from a whole plant food diet, just like you get all the carbohydrates you need, and you get all the essential fats you need. You don't have to take fractionated foods. And you certainly don't need one more white powder. Whether it's cocaine, sugar, or salt, white powder is generally not such a good thing. And salt gets people fat, even though salt has no calories. And you think, well, how could something with no calories make us fat? But part of the mechanism is something called passive overeating. So if you eat until you're normally satiated or full, you'll eat a certain amount of any food, say rice. If you salt that rice, everything else being equal, you'll eat more before you feel satisfied. And that's because salt artificially stimulates dopamine production in the brain. It contributes to overeating. So people say, yeah, because it makes it taste better. Well, that's exactly what tasting better means. It means it results in more dopamine stimulation in the brain. So if you eat something that stimulates more dopamine, you like it better. And that's why salt, oil, and sugar are such an insidious problem, because they're salt, oil, and sugar are being added to the feed. In other words, they're using the carbohydrates, usually refined carbohydrates, as a carrier agent. Think about bread, the staff of life, 1,500 calories a pound before you turn it into a butter boat and spread coagulated cow pus all over it. Just bread is highly desirable. People eat it, it makes them fat. If you take the salt, oil, and sugar and yeast out of bread, you have something called matzah, and it's punishment on Passover. That's not what people are getting in trouble with. The bread, the flour and the water are used as a carrier agent to get the salt, oil, and sugar to the palate. Think about beef. How many people go out of their way to go get some boiled beef and gnaw on that? Yeah, not so desirable. But by the time you put the salt on it and you charbroil it and gets a lot of acrylamides forming and other cancer-causing agents, now it has great appeal to people. You remove the salt, you remove the oil, you remove the sugar, you remove the desire of highly processed foods. And that's why we say that if you want to lose weight and keep it off and not have a failure rate higher than heroin addiction, you have to start accepting the reality that the answer is a vegan, SOS-free diet.
Well, it's nothing like speaking the truth. Now, obviously, fasting is effective. I can attest to that. And it's a safe way to treat this problem. I guess dietary excess, maybe we'd call it, from the bliss point, the chemicals introduced into foods, and just the way foods are put together so you enjoy them more. I know you go through in the book, there's everything that a person and their doctor would need to know about how, why, what the history is, what a lot of the research is. And when I was at True North, it's an idyllic spot because everybody is doing it. You're seeing doctors throughout the day, coming to your room and checking on you, and it's very peaceful and quiet. And they, don't want you running around or exercising much, which is probably why people preserve so much lean tissue when they fast with you, because you don't have to think about it. And so I guess, though, if you're fasting at the facility or you're fasting at home, is the protocol the same? What do you?
Yeah, so it doesn't matter where you fast. It's the same protocol. First of all, most important thing, make sure you're a good candidate for fasting. Now, some people, fasting would be a bad thing for them, and particularly people on medications that you might have difficulty getting off of, or that have conditions that might be aggravated by fasting. So the way we do that is history, examination, and laboratory testing. We offer a free service, though, including to your viewers. If somebody goes on our website and fills out the registration forms, I'll review their medical history and offer them a no-cost phone conversation so we can talk about, is this even something, that would be appropriate for them? And if so, try to direct them to the best option. For home fasting, as long as a person has a cooperative physician and this book, they have all the information they need to be able to fast safely. And it also allows the doctor to have, what testing to do, how to interpret that testing for people that are fasting. But there's still, so history, exam, lab, and then monitoring. So you just need to be in a restful state. You need to maintain hydration. And most importantly, as you come off the fast, you need to do carefully controlled prescribed refeeding. The mistake people make in fasting is they're either too active, so they do things that put themselves or other people at danger, like trying to drive and go to work or do things that would be inappropriate during fasting, or they come off the fast too rapidly and then you can get into refeeding syndrome or have post-fasting edema or have problems that can even be serious. So in order to avoid that, it's important that people do things right. They don't want to have a bad outcome and make fasting look bad. So, we try to really emphasize that. But that's part of the reason we wrote the book, because not everybody can come to True North Health Center. Certainly, that is a safe and effective way of undergoing fasting. But for people that don't have the ability to do that, now the book will give them the information they need and their doctor needs to make sure that they don't screw things up.
Great. Well, in addition to linking to the book, I'm going to give a link to that page where they can, contact you and find out from you what you think of their case and situation. And I know that there's at least one doctor with you who does some remote, work, who monitors people by phone or that kind of stuff as well. But I guess the important thing, as you say, is getting that history and an exam or lab and, get some kind of monitoring. And of course, you're right, the refeeding it was very interesting when I guess I had a 10-day fast, so I had 5 days of refeeding. The last day was when I was driving back home and you guys made all the food for me to go in these packages, which was wonderful. But, the first day, every day you get to add, at least in the way I did it, some other foods. You start with very gentle kind of raw to begin with and juice and that sort of thing. So I can see how, the first time I fast with you guys was 20 some years ago, back in the other facility that you had before you had the big place where you are now. And this fast was smoother for me than that one. I remember coming back. Maybe I came back too fast on that fast afterwards. But so yeah, that's all important stuff. I'm going to put those links, but you can read about it and everything you're talking about. You've really documented so thoroughly in here. And also you have a case reports in here. You talked about mine, the lipoprotein A thing. When I was there were some people who were fasting around and things like that. Have you got any studies? Have you been looking at people with that? Or
Yes,
can you talk about that on YouTube? I don't know, but go ahead. Careful.
There's a tremendous new group of patients that have been created thanks to Merck and Pfizer's intervention, where they have they're either long COVID where they've had COVID and have difficulties, or some of them have had problems where they react poorly to the profile, particularly people that have underlying autoimmune disease, history of cancer, and other things. There tends to be some exciting factors, and those fortunately appear to respond to fasting. And we've got our first case with 2-year follow-up of long, where the patient came in and had 2 years of just terrible traditional long symptoms from the brain fog on down, underwent fasting, had a great recovery. We've got long-term documentation, and now that's been accepted for publication. And that's the first long case that we've gotten actually published. As you can imagine, they don't want just people to get well. They want to show that you're able to sustain those results. And so, it's just now that we're getting some of the long-term follow-up that we're able to actually submit for publication. But I was actually a little bit surprised that we've been able to get these published, because it's still a pretty controversial, even acknowledging that long is an issue, or that injury can be an issue. That whole field is still controversial.
It's interesting because I was contacted not too long ago by somebody working on my case study. I had to sign some permissions to be used and so on. And it was being peer reviewed. I guess it's already been accepted now or whatever. But They wanted to know whether now, 6 months after leaving, had I sustained the weight loss? Was my numbers still down? Or, so I thought that was interesting and, important. That means they're thinking about it, who's ever doing these reviewing, to check follow up and see whether it wasn't just a blip, out of nowhere.
Right.
But, well, that's great. That's very interesting. How do you go about, how does this work when you publish these things? You don't have an IRB or anything, because it's you're looking back, right, at what's going on.
Well, yeah, fortunately, True North Health Center does have actually a federally chartered IRB that's affiliated with us. So we are able to get all of our studies cleared with case reports, as long as the patient is agreeable. And they're published anonymously, typically. I mean, you've gone public with your situation, but normally this is an anonymous thing. We can publish those. What's exciting is some of the bigger impact medical journals are now more willing and open to discussing that. For example, we published a case report in the British Medical Journal, case reports on a case of follicular lymphoma, where a patient had 2-year history of progression to grade 3 follicular lymphoma, was told by her oncologist that diet didn't matter, she could eat whatever she wanted, that fasting was criminal quackery, and ultimately came in, fasted for 21 days, and her tumors disappeared. And we followed this patient at 12 months. She continued to do well post-CT. We submitted a case report to the British Medical Journal, and the reviewers there were very interesting. It took some debate back and forth, but they finally decided that it was not unethical for us to have gotten this person well, because there was no acceptable medical treatment that reduces all-cause mortality. So therefore, doing this, they considered, was not unethical. Wow. And then they said, though, look, maybe she just got lucky. And so, and I'm thinking, well, gee, she had 2 years of progressive history and 21 days of fasting. It resolves. It seems unlikely that would be just luck. But anyway, they said, look, when you treat lymphoma traditionally, the tumors will sometimes go down, but then they come back. and sometimes worse than ever. So why don't you follow the patient for 3 years and find out whether she can maintain her results? And I explained to the patient that she had to stick strictly to the vegan SOS-free diet or it could be fatal because I would track her down and kill her. And she believed me, and so she stuck to the diet. 3 years later, we had excellent clinical outcomes with follow-up CT, and we resubmitted the 3-year follow-up as they had invited us to the British Medical Journal. Initially, it got rejected because one of the reviewers just didn't like the whole idea of fasting and diet and stuff. But ultimately, they decided to publish it. And it's really the first, if you go back and look through all the case reports over the years in the British Medical Journal, it's really the only one that looks or smells anything like that. But because of that, we were given exposure. And now we've treated dozens of patients with lymphoma. And we've been tracking some of those people with long-term follow-up. And now we have just got accepted for publication a case series, which included that woman who came back at 10 years and she's still cancer-free.
Wow.
Whole body CT, everything looks great. And then we've got some other even more severe cases that had metastasized into the bone, people that had had treatment that failed and it had recurred. And we've published those together as a case series. And that'll be coming out next month in the medical literature. So we're very excited about that. And we're hoping it'll be enough to justify a clinical trial where we can do a random assignment to condition a large number of lymphoma patients, half of which will get conventional care and half of which will get the benefit of fasting and diet. And we'll compare long-term to see what works better, getting healthy or staying sick. And so, we're excited about that. And again, it was a patient of ours that has gone public and talked about her experience. And that's why we've gotten so much exposure and gotten a chance to treat so many of these patients that we're able to actually publish some good long-term outcome data.
That's amazing. So let me ask you, for medical professionals who might be listening, what, would you advise them to, hey, incorporate a fasting intervention into their practice? And what resources, how can they, learn and be trained in this area?
Well, there's two things we do. First of all, I'd recommend they get Can Fasting Save Your Life? Because it's designed to give information not just to the lay reader, but also to physicians, the information they need to understand how fasting works, what type of testing and monitoring is necessary, what that means, how to interpret that. If you look at the back of the book in the appendix, there's a lot of graphs and charts that provide doctors the information they need to be able to really understand what's going on there. And second of all, if they're interested in doing something worthwhile with their life, going to heaven instead of hell, what they can do is come to the True North Health Center for an internship or residency program. It's no cost to the doctor. We provide them room and board and training, and they can come in and actually work with patients and see how it works to actually get people well. It's rather novel for most doctors because most of them will tell you, wow, this is the first time I've ever seen anybody with this condition get well. Because, if you have high blood pressure, for example, and you're treated conventionally, your doctor will guarantee you'll never get well. They'll tell you the first day, you'll be on these drugs the rest of your life. And yes, they may have side effects like chronic cough, fatigue, impotence, or premature death, but that's the best you can do because nobody ever gets well. And so here you get a chance to see, oh no, people do get well. In fact, in a study we published some years ago with T. Colin Campbell from Cornell University, 174 consecutive patients with hypertension, 174 people lowered their pressure enough to eliminate the medications. So we have the largest effect that's ever been shown in treating high blood pressure in humans with an average effect size of 60 points in stage 3 hypertension. This is a highly effective way of treating high blood pressure. In fact, we recently completed a prospective study with our colleagues from the Mayo Clinic, where we had 29 people with hypertension enter into a study with fasting, and 28 of the 29 people completely eliminated medication, normalized blood pressure, and one of the patients had to continue to be on 50% reduction in dose at 6 weeks. And then we said, what would happen if that was the end of the study? What would happen if we tracked those people down at a year? How many people would have maintained their weight loss? How many people would have maintained their normal blood pressure without drugs? And, I'm talking to Dr. Lyle about this, and he says, well, 1 in 20 people can make dietary and lifestyle changes. 19 out of 20 will fail, just like we talked about the weight loss data for losing weight.
Right.
I said, well, but our people are special, so they'll do much better. And it turned out, I said a third of them would be able to maintain their weight loss, maintain normal blood pressure, and not be on drugs. We tracked them down in a year, and of the people on the follow-up, 75% had maintained their weight and their blood pressure drug-free state. 25% had people that had trouble, some with compliance, some with their doctors. Some of them actually had normal blood pressure, but the doctors insisted you had to be on drugs regardless, forget about the numbers and the facts. So it turned out I was wrong. It wasn't a third, it was 2/3. But Dr. Lyle was more wrong, which means I win. Now he's arguing, he was talking about the population as a whole, not our highly self-selected, highly motivated True North patients. But in fairness, what did he think we were recruiting for our study? We think we're going on the street and dragging them off the street? Of course it's going to be our patients. Highly motivated, self-selected people clearly do better than people that are not highly motivated and self-selected. But nonetheless, we've shown that at least highly motivated people can maintain diet and lifestyle change over a long period of time, and that the results are not just when they're locked up at the True North Health Center, but also can be extrapolated to those people when they're back free living.
Wow. So there's so much great research that you've been doing, that you are doing now. It's very exciting. What is the research? What further research do you think is needed in this field?
Well, there's actually a lot of studies. In fact, if you read our book, Can Fasting Save Your Life, all of the research that we've done has been summarized. And so it's a really good aggregation of the data that we've done, and others like Walter Longo and others have done some fabulous work with intermittent fasting and different versions, of this kind of approach. What we're doing next is a prospective study, random assignment to condition with a local HMO, where we're going to compare standard of care, which is take drugs for the rest of your life, to standard of care plus the benefits of coming to the center for a fast and some instruction and get them off their medications. And then we're going to do long-term follow-up, looking at not just at blood pressure, but all the various biomarkers, including lipoprotein(a), to see if we can get people to sustain the behavioral changes and what the long-term results are going to be. We're pretty confident of what we're going to see, because it basically is the same study we do in the Mayo Clinic, but this will be the first random RCT, random condition. So 90 people are enrolled in the study, 45 just get standard of care, another 45 randomly assigned will undergo standard of care plus the fasting. So it'll be a fair comparison to see, what kind of impact fasting has, in addition to the normal care that's provided to people for high blood pressure. If that works and they are comfortable with it, then what we propose to do is do exactly the same kind of RCT, but with lymphoma.
Oh, that'll be
interesting.
Then
the other thing that we're going to be starting next year is a large study. We're going to enroll somewhere between 2,000 and 3,000 people, and we're going to follow them for the rest of their life. And what we're going to be looking at in these people is people willing to eat a whole plant diet and do fasting once a year for a week. Because we believe that fasting every day for 16 hours or 12 to 16 hours, in other words, don't eat 3 hours before you go to bed, eat in an 8 to 12 hour window, eat a whole plant food diet, is going to help people not just age better, but avoid the debility that so common occurs in the last 10 or 20 years of life. So we don't think you can live forever. We think you're going to die at some point, but we want you to live until you die, fully functional, not find yourself unable to talk or move, lying in some nursing home bed, waiting for people to come and change your diaper, but rather maintain a high degree of functionality so that the last 20 years of your life can be the most rewarding, most engaging, most pleasurable, rather than the worst. And also recognizing the fact that society spends most of its money on healthcare in the final years of a person's life, but that expensive healthcare doesn't necessarily make people live longer or better. And so we think it could really revolutionize healthcare if you can get people to stay healthy and have a good life and then a good death. Where they go to sleep one night and don't wake up, rather than find themselves debilitated for years and dependent on others.
I think of that patient John McDougall talked about. It went on one of his Costa Rica trips and did the zip lining. He was 92 years old. McDougall went first, then he came, and when he arrived, he was dead at 92 zip lining. I don't know how much better you could get than that. But so people. I
know my mom, when she was 92, she said that all of her friends were dead. She'd outlived everybody. And she said it was getting harder and harder to make new friends because even people 10 years younger than her were still too old and sick to do the things she liked to do. And she said, Alan, you have to warn your patients, if they're going to do this type of a diet, make younger friends.
Good advice. Good advice. So people can read the book and determine if they are a good candidate for fasting. They can click the link and submit their data to you, right? And you'll give them a call
Right.
and discuss their
Sure.
situation. What do you think? What is the key message that you hope readers are going to take away from this book? And how is this going to help contribute to the conversation around health and healing?
Well, the basic message is health results from healthful living. And healthful living is diet, sleep, and exercise. And that if you're not eating a healthy diet and you gain fat, you're also going to gain visceral fat. And visceral fat produces the inflammation that causes heart disease, cancer, diabetes, and autoimmune disease. If you can make the diet and lifestyle changes and recover, that's great. If you're having trouble with that, fasting can be a useful tool to facilitate the transition from a standard American diet to a health promoting diet, or from a relatively healthy diet to an extremely healthy diet. And so that it's kind of a nice way to facilitate that neuroadaptation, the change in palate, and just give a person a chance to recalibrate. It's kind of like if you have a computer that's not working right, sometimes if you just turn it off and you turn it back on, it starts working. You don't know why, but just rebooting the hard drive tends to recalibrate the internal mechanisms. Well, fasting is kind of like that. If you just shut everything down with a fast, turn it back on with a healthy whole plant food diet, the body does an amazing thing. It heals itself.
Well, folks, we are very lucky that Alan could join us today, Dr. Goldhamer, and enlighten us. He's a very busy guy. I promise not to go too long with him. The book is Can Fasting Save Your Life? It's not a difficult read. It's easy to understand language. If you're looking for a way to achieve your healthiest weight, to lower your risk of having problems, if you want to live, as he says, right up till the end when you die, I'm going to urge you to read this book and take this information to heart. This is a really, a roadmap to having a healthy health span, I think you could call it, and maybe extend your life too, but being healthy for as long as possible. That's really what it's about. We all want to be Alan Goldhamer's mother, who's, got to have younger friends because she did it right. There's a link to the book below, as well as a link to the True North website and the other stuff. Dr. Goldhamer, thank you so much for coming today. And to the viewers, give it a like, give it a share, subscribe. Thank you, Alan. Come on back soon.
Thank you.
And everybody, we'll see you on the next one. Bye-bye.
What I think is really interesting is, you take a guy like yourself that's a healthy guy doing the right things, and you see that there is incremental improvement, though, that occurs. I think that's really inspirational because, it's like that's really the target audience, is the people that just need a little fine tuning. They do so much. I think that's who gets the biggest results. Now, sure, the sick people get benefit, but it's the healthy people. And that's the ones that I think I'm really excited about, because I know your audience tends to be vegetarian, sympathetic. They're already doing a lot of the right things. They just,
yes,
need a little fine tuning around the edges. And I think that you've set such a good example for them.
Oh, I mean, I'm sold. I plan to do a fast every year for the rest of my life. I can just see the benefits are so immediate. They're in 2 weeks, you have a dramatic change. You feel better. You're sleeping better. Things happen. The weight, you've wanted to get your weight down, and and then suddenly your weight is down. And, hey, it's staying down. Damn.
And then it's more motivational.
Yeah, exactly. I tell everybody in my family, hey, you got to go do this. My brother's going to be coming up to see you. I know that, there's a demand, like, it can be hard to get in, plan ahead, but it's worth it.